Hi, today everybody. This is Stewart Gandolf at the Patient Experience Summit at the Cleveland Clinic. Today I'm interviewing William Johnson, who is in charge of patient experience for the Memorial Health System in Springfield, Illinois. William, I'd like to ask you to give our audience a little bit of understanding about your role and what you do.
Sure. For the Memorial Health System, you can kind of think of me as the internal consultant to the health system. So I travel the healthcare care system. I work with people. I work with teams on this thing we chase called the patient experience. So we look at engineering the experience. We look at different techniques, different initiatives to get going across the health system, and I help coordinate that.
Terrific. Now, one of the things we talked about today was the challenge of clinicians, especially doctors, are oftentimes very left-brained people, and so obviously we want to do as much training as we can to help them be better at interacting with patients. But William brought up a very important point, which is the time actually spent with doctors is a relatively small part of the engagement with a patient. So if you could talk us through the four stages that you shared with me about the various stages of engagement with the patient, and then also some of your recommendations along the way.
Sure. Well, when we look at the patient experience, we really think about different layers that the patient travels through to reach the physician. So the first layer would be the pre-arrival. That would be the telephone, taking insurance information, pre-registration, then the arrival at the facility or the location, going through the registration process, and then some type of a pre-procedure or pre-visit area where the nurse takes the vitals and those types of things. That consumes the majority of time that the patient, in the patient's experience. Then their time with the clinician, with the physician, is usually very brief. So what we do is when we engineer the patient experience, we're focusing on that 90% of time that leads up to their time with the clinician, the physician, to try to help shape the patient's expectations and really engineer the patient experience along the way. So that's kind of the approach that we take. And I'm so blessed, I have time that I get to actually spend with the physicians. And my approach with them is not to talk medicine, because that's not what I do. I just try to help them identify ways as they interact with their patients to really help improve ultimately the clinical outcome. And that is the difference in the mechanics of delivery versus the humanics of delivery. So I don't really approach the left brain world when I'm working with the physicians. We just try to focus on the right brain type of social interactions that patients and families expect during their time with the clinician to help enrich that patient experience and ultimately will drive better clinical outcomes for the patient.
That's terrific. I'd like to ask you, do you have any specific wins that you're really excited about? Some things you're particularly proud of that you've been able to do within your job and the people you work with?
Yeah, I think I think one way that you can gauge when you're starting to become accepted by the physicians is when they reach out to you and ask you to come and shadow them for 2 or 3 hours and to observe their interactions during their time with the patient and to give some feedback to them on how they can improve that social interaction time with the patient. So for me personally, it's when they reach out to me, you know that you're being more accepted in that by that group and asking for some help and those type of things. But the other thing that we monitor over on the HCAP side, especially on inpatients, as we watch that score of physician communication as we begin to work or do more work with the physicians, and we see that physician communication domain on the HCAPs improve and improve and improve. They're really not doing anything different. They're just being perceived in a different way. And that is the right brain, those social interaction type of behaviors that physicians have during their time with the patient.
Any last bits of advice for our readers if they're interested in improving their patient experience at their hospital or practice?
I think we can all say this because we're all in it. It's a marathon. Since we're here in Cleveland, today was the Cleveland Marathon. It's a marathon that we're running, but there is no finish line. It's something that we continually do. We continually work to improve, and you can't turn your back on it. You have to be focused on it, and you have to have your fingers on the pulse of the patient experience at all times, because it will change over time. So it's just being focused on it, continually working on it. Don't turn your back on it. We're all in it together.
That was terrific. Thank you so much, William. Thank you so much for listening.